New today, we're one day out from a very important meeting between nurses in Seattle Children's Pediatric Mental Health Unit and the hospital's top brass.
That meeting is the result of multiple attacks inside the hospital. The nurses say that they're failing their patients. Fox 13's Matthew Smith is tracking the concerns.
Usually when you think candlelight vigil, you think loss of life. But in this case, it's more about a loss of confidence. While attacks and injuries have drawn attention, the nurses I've spoken with say the hospital's failing to keep up with changes as our state is now in a full-blown youth mental health crisis.
Our compassion is basically being taken advantage of. We are willing to create options, willing to create solutions, trying to make the unworkable work, and ultimately, my compassion for this field is what's bringing me back to this job. However, there is fear, there is concern, there is anxiety-induced feelings that I don't know what I'm going to step into.
It's the issues unfolding inside of Seattle Children's that you so rarely hear about. While attacks of nurses and police physically being called into the psychiatry, behavioral, mental health unit have grabbed attention, multiple nurses tell Fox 13 the bigger concern here is a broken system. Too little space, too few people, and patients trapped within their walls for weeks and months when their system is really only built for a few days. After dozens of nurses sounded off in an email to top staff, they still felt like no one was listening. So instead, they turned to Fox 13 to talk about the issues at Seattle Children's. But the state as a whole is facing their own issues.
We're built for 5 to 7 days for a short crisis stabilization stay. What's been happening, though, with the lack of resources is we've kind of turned into a longer-term solution where patients are staying for months waiting for outpatient resources.
There's nowhere for them to go. There are no long-term care beds available, and there's super long wait lists. So what's happening is these kids who are suffering to begin with are now stuck behind locked doors in a very sterile environment with a bunch of arbitrary rules.
So on Wednesday, the nurse team will meet with hospital leadership. Tonight, a way of gathering support and getting their story out. Now, they're also trying to add some pressure to Seattle Children's. For their part, they say they've implemented changes to add more resources, but nurses say much more work remains to be done. Of course, we'll be staying on top of this story. Matthew Smith, Fox 13 News.